Day surgery is now the treatment of choice for a large number of patients. The advantage being that you can come to the hospital to receive your procedure and be discharged home on the same day with full advice and a number to call should you have any questions or concerns. To get to Ashford Hospital Day Surgery Unit, it's located on the ground floor, approximately 100 metres from the main entrance. Please enter through the main entrance of the hospital, turn right and walk down the corridor following the signs marked Day Surgery Unit. Once at the day surgery reception, you will be asked to sit and wait in the reception area for a short while until you are seen and admitted by one of the nurses. Please remember to bring your admission letter with you. At Ashford Day Surgery Unit, we have a drop-off and pick-up only policy for relatives. This means that once you have been admitted into the day surgery unit, accompanying relatives or friends cannot stay, but they can wait for you nearby until you're ready to be discharged. For your friend or relative, there is the Aspects Cafe just down the corridor where they will be able to get a bite to eat or something to drink. Alternatively, there is a large supermarket right next to the hospital should you want anything from snacks to flowers or greeting cards. Back at the day surgery unit, one of the nurses will show you to a private changing area where you can change into a hospital theatre gown. After you have changed, your surgeon and anaesthetist will see you in a private consultation room to discuss your procedure. Here you'll be asked to sign a consent form. Please read this carefully and take this opportunity to ask the doctors anything you are unsure about. At the Ashford Day Surgery Unit, we have 7 operating theatres and an endoscopy room that have all the equipment required for your procedure to be undertaken in a safe environment. When the time comes, you will walk to the operating suite with a nurse, and afterwards you will be taken to our single-sex recovery area. Here, our trained staff will make sure that you are well cared for following your procedure. Following your transfer to the day surgery ward, you will be continually assessed by a nurse who will determine when you are well enough to be discharged home. You will be given full advice regarding your care after discharge and a telephone number to call should you have any questions or concerns, day or night. Before you go home, the discharge nurse will bring you any pain relief medication you might need and explain when to take it. If you have had a general anaesthetic, it is important that a responsible adult accompanies you home in a car or a taxi and stays with you for the first 24 hours after you have been discharged. You will receive a phone call the day after your surgery from a day surgery nurse to check that you are recovering well. And we hope that your experience at the Ashford Day Surgery Unit will be as comfortable and pleasant as possible and that you make a speedy recovery.